Good evening to everyone present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Narsimhan Subramanian. Sir is MS, FRCS, FRCSED, FIAMS, urologist at Apollo Hospital at Delhi. Now, with the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is common concern about prostate health in men. Now, without any further delay, I would like to welcome Sir again at our forum and would like to hand over the session to him. Over to you, Sir.
Good afternoon and namaskar to everyone. Thank you for the opportunity to share a common topic that we see in urology. I am Dr. Subramaniam, and I have been practicing as a urologist for a little over 35 years. When we look at urology-related problems, we look at problems relating to kidneys, the urinary tubes, the urinary bladder, the prostate in men, and urinary infections, incontinence, etc. in women, and also various cancers associated with any of these organs. Today, we will be discussing the topic on prostate and the concerns relating to that. I am aware that we have many of my medical colleagues who are listening in, and I'm also aware we have non-medical members from the community who will join in. So I will wish to briefly begin by describing what the prostate is, where it is located in the body, what its functions are, and what are the possible difficulties or problems which one faces with the prostate. The prostate is a small gland which is about the size of a normal walnut, and it is located where the urinary bladder or the pouch where the urine is stored, where that joins the pipe through which the urine comes out. That is called the urethra. So the prostate sits just around the neck of the bladder where the tube begins. During the childhood, it is an inactive kind of a gland, and it is present only in males. The first spurt of some increase in size or the growth begins at puberty. Then it remains quite stable for several years. And men in their 50s, 60s, and 70s would often find that there is an enlargement of this gland. And because this gland is surrounding the opening, the urinary opening at the mouth of the bladder, and because it can project into the bladder, it causes various symptoms. When we look at the normal functioning, what is the function of the prostate? The prostate basically produces a lot of fluid which helps in the transportation of the sperms and also provides nutrition to the sperms. So during the age at which men are reproductive, it is useful to function from the reproductive point of view. Now, what happens? What are the types of difficulties one can have with the prostate enlargement? What are the symptoms that people have? And what are the possible diseases that might be there in the prostate? And lastly, how do we evaluate? How do we assess? How do we treat people with symptoms associated with the prostate enlargement? How do we treat any associated infections? How do we treat any cancers that might arise in the prostate? So let us first look at what are the possible diseases that can affect the prostate. The most common one is an enlargement, which is not cancerous, which is not due to an infection. That is called the benign enlargement of prostate or the benign prostatic hyperplasia. What happens is there is an age-related enlargement which begins in the 50s and goes on to the 60s, 70s, and 80s. So there is a gradual increase in the size of the gland without any evidence of infection or cancer. The second condition which can cause symptoms is a swelling or an inflammation relating to infections in the prostate associated with urinary infections. Third is the enlargement of the prostate, which is associated with the development of a cancer in the prostate. So let us look at what kind of problems do men experience when they have any of these conditions. So let me begin with what happens in the age-related benign enlargement of the prostate. The most common symptoms that people complain about would be, number one, an increase in the frequency of urination. Men would often complain about having to get up to pass urine more than once or twice at night. Men may feel that they are going more frequently to pass urine during the day. Sometimes they will feel that when they get the urge to pass urine, they are not able to control the urge. So they would need to either immediately rush, leaving whatever else they are doing, and rush to the toilet. And in more severe cases, they may find that the urine begins to pass even before they reach the washroom. In addition to this, people also find that the flow of the urine becomes poorer. It's a weak stream, which they may notice that it comes out more slowly. It takes longer to empty, and the stream might be very thin. It might fall closer to their body, sometimes wetting their shoes or their clothes. So these are the most common symptoms, which we broadly classify into storage symptoms and voiding symptoms. The storage symptoms are the ones where we said greater frequency, greater urgency, and not being able to hold for long. While the voiding symptoms are the ones where there may be a delay in starting the urination, a poor kind of a flow, or a sense of incomplete emptying of the bladder. In addition to that, if there is an associated infection, there is also pain, there is burning when they pass urine, very frequent urge to pass urine when they would pass only a few drops, may be associated with some blood in the urine, sometimes associated with fever and shivering. All these can be associated with infection in the urinary bladder or in the prostate or in both. Then, as people are living longer, we know the concerns about cancer of many organs is increasing. We are all familiar with lung cancers and mouth cancers in men and women. We are very familiar with breast cancers and cervical cancers in women. Cancers of the intestines, the colonic cancers, stomach cancers, cancers of the food pipe are all increasing as people are living longer. Cancer of the prostate is the second most common cancer in men, accounting for quite a few of these people dying from the cancer. However, the important point to remember is prostate cancer, when it is diagnosed at an early stage, we are in a position to cure the disease, and most men diagnosed with an early cancer of the prostate would live without any evidence of disease well beyond 10 or 15 years or even longer. The symptoms with prostate cancer, again, could have the symptoms related to the prostate enlargement, non-cancerous, or also have symptoms due to the local effect of the prostate cancer, where it might start blocking the tubes which bring the urine from the kidney into the bladder, called the ureters, or it can cause bleeding in urine. Sometimes the cancer can spread to various parts of the body, including the bones, the lungs, the liver, the spine. So it can cause various changes, including various fractures in the bones. It can cause a compression and start a pressure on the nerves which come from the spinal cord, and causing changes, including paralysis or a non-functioning of the bladder. So when you compare that with the situation where you're able to treat the disease well and adequately, you can understand why it is so important to diagnose prostate cancers early. So having looked at the common symptoms that might happen with the enlargement of the prostate and what can happen with an infection in the prostate, or what can happen with prostate cancer, let us briefly look at what kind of tests, common non-invasive tests that are possible, which will help you to diagnose various conditions, both non-cancerous and cancerous. So let us look at somebody who came in with the symptoms I mentioned in the beginning, which include frequent urination, poor control, poor stream, incomplete emptying, any of these. How would we investigate them? Very simple tests. We will do a test to rule out any urinary infections. We will do what we call a urine routine test and a urine culture. We will do a blood test for the kidney function test and a blood test for the prostate specific antigen, a chemical produced by the prostate. Then we do a simple ultrasound, which is called an ultrasound of the KUB, which looks at the kidneys, the ureters, the bladder, the prostate. It's able to tell us if the prostate is enlarged. It's able to tell us if the bladder is storing more urine or less urine than normal. And it will also tell us, are there any other changes in the bladder which could account for these symptoms. Then we also do a test called a uroflowmetry, where the individual would pass urine into a machine. So this will be able to indicate if there is an obstruction or a restriction to the passage of urine by this simple test. So as you can see, a blood test, a urine test, a simple ultrasound, and a urine flow test are usually enough to understand the state of your prostate, understand the condition of your bladder, understand the likelihood or a non-likelihood of a prostate cancer, and also understand the way your kidneys are functioning. Based on these, treatment can be initiated. On the other hand, if we find that we are suspecting a prostate cancer, how does this happen? This could happen If during the examination by your doctor, the prostate is found to be having a significant enlargement, an area or two in the prostate which may feel irregular, hard, or nodular, or if the blood test for the PSA indicated that the PSA levels are higher than what they should be, then one must keep in mind a possibility of a prostate cancer, in which case we will do some additional tests in the form of an MRI scan of the prostate, and based on that, if necessary, biopsy of the prostate from various spots to rule out any cancer in the prostate. In case we find evidence of a cancer in the prostate, then we will evaluate it further with special scans to see if there is any spread of the cancer beyond the prostate gland. So once you have arrived at a clear diagnosis as to why is the prostate enlarged, why are there symptoms with urination, is there a likelihood of a prostate cancer, etc., we are ready to initiate treatment. Whenever people come to me, they often ask me, Doctor, is it necessary for me to have a surgery for my enlarged prostate? The answer is yes and no. No, because quite a few people, almost 50% of the people who come with symptoms of prostate, after their evaluation, will respond very well to medication. The medication will improve their symptoms. And for those where the symptomatic improvement is good and sustained, these people will not require surgery. On the other hand, people who may require surgery will include those whose symptoms continue in spite of being on medicines. Number two, people who are storing very large amounts of urine in the bladder with significant obstruction to the flow, which is not improved with medication. Or those who have repeated urinary infections, or those who have recurrent bleeding from the prostate, and those whose kidney functions are adversely affected due to a blockage of the urinary passage. These are people where you may consider early surgical intervention. Now, let me talk to you about the types of surgeries that will be available for the prostate. For non-cancerous prostate enlargement, surgery is usually done through the normal urinary passage, or what is called a transurethral surgery. There is no cutting or major surgery involved in these patients. While those with a cancer in the prostate, if they undergo surgery, that will be a more major surgery. However, the recovery from that has become significantly easier and quicker since the introduction of robotics into surgery for prostate cancer. When you talk to people who are your friends, medical or non-medical, urologists or non-urologists, you will hear about many treatments, surgical treatments, and many medical treatments. Let us look at the medical treatments first. Medical treatments would comprise of two sets of medicines, one for the prostate and the other one to improve the symptoms of the urgency or difficulty in controlling it or the frequency, etc. And for the prostate itself, there are two sets of medicines. One, which improve the flow of urine, and the second, which will help to reduce the size of the prostate gland, either by reducing its size or at least slowing down its enlargement. The common drugs one would hear about in the world are called tamsulosin or alfuzosin or silodosin, along with another medicine called dutasteride, or in some places, finasteride. To help to improve the urine frequency and the ability to control, there are common medicines called mirabegron, solifenacin, darifenacin. So these are some of the medicines which are used for the control of symptoms. If, on the other hand, if you found that you needed surgery, the most common types of surgery you would hear about are one called a transurethral resection of prostate, or a TURP, which is a procedure where we use an electrical system to remove the inner portion of the prostate which is enlarged, done through the normal urinary opening. The second, again through the urinary passage, removing the enlarged prostate, would be using a type of laser. The most common one is being called the holmium laser enucleation of prostate. Other types of lasers which have been used, including the thulium laser or the green laser, where in one we remove the gland, in the other you actually what we call vaporize or burn it away. So these are the common surgeries for non-cancerous prostate. The long-term outcomes with most people, when I say most people, over 90% patients who undergo either of these surgeries will recover well and will have a benefit from surgery. People often worry about what are the adverse effects of surgery, or will I have a constant leakage of urine and not being able to control my urine after surgery for non-cancerous prostate. The number of people who are unable to control urine after surgery for non-cancerous prostate is less than 1 to 2%. So majority would do extremely well. Common questions people ask would be, what is the likelihood that the prostate might regrow? What is the likelihood that I may need a second surgery? The chances are somewhere in the range of around 5 to 7% over a 10-year period. Now let us look at the cancer of the prostate. If there is a cancer of the prostate, then the outcomes will depend upon the type or the grade of the prostate cancer. Whenever we do a biopsy and find that there is a cancer in the prostate, we grade it according to a score which is called a Gleason score. That will indicate how aggressive the cancer is likely to be. So once we know the type or the aggression of the cancer, the blood test which would tell us about the level of PSA, again indicating, is it likely to have spread or not spread? And that being further verified by a special scan called a PET scan, we will know exactly, are we dealing with a cancer which is localized, or is it a cancer which has spread beyond? In the past, we used to find many of the prostate cancers occurring in a very advanced stage because people did not have the mechanisms or the access to get the disease diagnosed early. In today's world, with the availability of a PSA as a blood test, an ultrasound, and an early or an easy access to your family doctor or a general surgeon or a urologist, many of the prostate cancers are diagnosed early enough for us to be able to treat them with an expectation of a cure. So, what are the likely treatments possible with prostate cancer? Again, the options are surgery, which is reserved for the early stage of the cancer, where we are able to get rid of the cancer and are able to assure a good long-term outcome. Second option is there are some where radiation treatment is an equally good option. The choice of which one would be better for a given patient would depend on, like I said, the stage of the cancer, the grade of the cancer, and the patient's concerns about the side effects of the surgery or the radiation. There are people who would unfortunately still come to you with disease which is already advanced at the time of diagnosis or will lead to a progression after diagnosis. These are people who are again quite successfully treated with a combination of hormonal treatments, chemotherapy, and various other kinds of mixed therapy of several drugs. Lastly, where there are associated complications, like if there is evidence of the disease having spread to the bone, especially where we are worried about a risk of a compression or a fracture, we might use local radiation for those. And so a combination of medicines used in a sequential fashion or a combination or combined with radiation would by and large manage to treat majority of these cancers. So broadly speaking, this is a gross simplified version of what the prostate is, what can happen with the prostate, and what are the mechanisms which we have to treat them effectively. In one line, if I were to say, where we are today, vast majority of the people with problems relating to the prostate, either due to an infection, age-related enlargement, or a cancer, can be successfully treated. So I wish to thank you all for your attention, and I'll be delighted to take any questions from anybody. And I want to thank the organizers for inviting me to speak on this subject. Thank you very much.
Thank you so much, sir, for this wonderful talk. We do have some question from our audience if you'd like to take that up.
Sure.
So, sir, the first question is, what are the early signs and symptoms men should watch for that may indicate prostate problems?
The common symptoms that we see are one, having to pass urine more frequently, difficulty in being able to hold urine when there is a sudden urge to want to go, a little delay in starting the urine, or a weaker stream or an interrupted stream of urine. These should be amongst the most common starting points.
Thank you, sir. Next up, we have, how does age affect the risk of developing prostate related conditions like BPH or prostate cancer?
Sorry, can you repeat that question?
Sure. The question is, how does the age affect the risk of developing prostate related condition like BPH or prostate cancer?
Right. Most conditions which affect the prostate are age related and what tend to begin in most people after the age of 50. We know that if you look at people between 50 and 60, maybe almost 50% would have some degree of prostate enlargement. Similarly, those between 60 and 70 would have 60% chance of an enlargement, and 70 to 80 even more. Similarly, with the rising age, there is a higher incidence of prostate cancer also. I might like to just add here that people who have a family history where the father or older brothers or paternal uncles have had prostate cancer, there is a higher risk of prostate cancer in these people. Similarly, certain types of breast and colonic cancer amongst the mother or the immediate female members of the family are also genetically known to be associated with slightly higher risk of prostate cancers. Thirdly, there is a variation in prostate cancer occurrence between different populations. It is most common in the Caucasians and less common in Asians. So there is a variation as well.
Thank you, sir. Next up, we have what lifestyle changes can help to maintain good prostate health and reduce the risk of complications?
See, there are no direct connect between your lifestyle and prostate enlargement. Some of the studies which have come up from the Western world from previous indicate that higher intake of fat in the diet, higher intake of animal products, higher intake of meat and related fat products are associated with a higher risk of earlier enlargement of the prostate. Similarly, when you find an association of urinary infection, again, if there is a restriction to the urinary flow due to a prostate enlargement or other conditions of the urinary passage, there is a higher risk of infection, which can also affect the prostate. In terms of prostate cancer, like I said, that if there is a family history or certain genetic patterns, there is a higher incidence.
Thank you so much, sir. There is one last question. It is, how can men differentiate between beginning of prostate issue and symptoms that require urgent medical attention?
Right. See, the symptoms wise, what we discussed earlier, would not on their own be able to tell us how acute the problems could be. But all of us as human beings, when you see something which is causing intense pain, conditions which are causing pain or burning or high-grade fever or blood in the urine, that sends the alarm for most of us. So we would rush for treatment. Similarly, the other condition where people will need to seek help very quickly and urgently is when there is a stoppage of urine, a condition called retention, where somebody suddenly finds that he is unable to pass urine. So the urine is all stored up in the urinary bladder. There is a lot of pain in the lower part of the stomach. The person repeatedly keeps going to try and see if he can pass urine and is unable to pass urine. Those are the emergencies.
Thank you so much, sir, for answering all our questions. That's all from our audience, sir. Before concluding, sir, any take-home message from your end?
The two take-home messages. One, many of the prostate-related symptoms, because they are not always interfering with your life significantly, people often tend to ignore them. My request would be that we should not be ignoring these symptoms. And secondly, we know that majority of them can be treated quite safely and adequately. Second, since the outcome of treatment between early prostate cancers and late prostate cancers is so different. Just to give you an example, people with early prostate cancer, majority of them would live a normal life beyond 10 to 15 years. Whereas once prostate cancer is advanced, most of them would possibly not live beyond 5 years. So it's very important that even if there are no symptoms, beyond the age of 50 or 55, we would like people to have an annual health check where a blood test for the PSA, an ultrasound, and a physical examination by the doctor will help to detect anything where there may be no symptoms at all. So just as a caution, the health check becomes important. The same way that diabetes and hypertension and cardiac conditions are often not always obvious, but if detected early enough and treated properly, reduce the risk of heart disease, reduce the risk of stroke, reduce the risk of blindness, reduce the risk of kidney failure, and so many other things. So those are my take-home messages.
Thank you so much, sir, for conducting such wonderful session for us. It's our pleasure to have